Hi! Are you worried about your newborn and wondering, is this normal peeing and pooping pattern? Is the color okay? Is my baby doing fine? Well, welcome to today's Ask Me Anything episode, where I answer your most common questions. Before anything else, I'm Dr. Kristine Alba Kiat. I'm a board certified pediatrician, and my mission is to empower you, moms and dads, so you can raise happy and healthy kids. And in today's episode, we are going to talk about the 10 most common questions that you might have about newborn peeing and pooping. So let's get started. First question: how often should a newborn pee and poop? Well, in the beginning, for a 1 day old newborn, peeing pattern is usually one wet diaper a day, and then on day two, it becomes two wet diapers a day, and until much later, when a newborn would usually have six wet diapers a day. And how about pooping? Well, it depends for breastfed and formula fed babies. For breastfed babies, it is common to have several poopy diapers a day. Even parents would notice that after the baby breastfeeds, the baby would poop immediately, and that is normal. However, for formula fed babies, it is normally one poopy diaper a day, one to two. All right, next question. What should the color and consistency of newborn poop be? All right, baby's first poop immediately after birth is called meconium poop, and it is black tarry stool that you notice right after birth in the first two days of life, and then it becomes transitional poop where it becomes greenish to black in color, and then much later, as the baby has fed several times, the poop then transitions and becomes mustard yellow poop. And this is about fourth to fifth day of life. And the consistency of the poop is described as seedy. All right. Next question. Is it normal for a newborn to strain while pooping? Well, yes, it is normal for babies to strain while they poop. Just imagine lying down and trying to poop. And so it is okay for babies to strain. And also, at this stage, the baby's digestive system is still developing. So it is a normal reaction for them to strain while pooping. But you need to worry if baby is irritable to the point that baby would cry and would have a hard time pooping, and there is no poop right after a straining episode. In that case, you may need to worry and let your pediatrician know about it. Okay, why does a newborn why does a newborn's poop sometimes contain mucus? Well, a small amount of mucus in babies' poop is normal. But if you notice a large amount and you're worried about it, it is better that you let your pediatrician know about it. Okay. How can parents tell if their newborn is dehydrated? Yes, this is a good question. So, signs that your newborn might be dehydrated: if your baby is lethargic or weak looking, if you notice that your baby has dry mouth and lips, if baby has sunken eyes, and a good gauge is that there are fewer wet diapers in a day than baby's usual peeing, and also if there is dark urine. If your baby has signs of dehydration, you should better let your pediatrician know about it or bring your child to the ER. All right. Should parents be concerned if their newborn has blood in the stool? Well, if you note that there is blood in your baby's poop, it is an important topic to discuss with your pediatrician. In some cases, it might be sensitivity of the baby to the milk, or it might be some gastrointestinal digestive issue that needs to be seen by the doctor. All right. How do you properly clean a newborn after they poop? Yes, this is important as well. So, to properly clean your baby, it is important that you wipe from front to back, especially for girls, to prevent urinary tract infection. Again, wiping from front to back. And how about it is best that you wash with soap and water. You can also wipe it off with a soft cloth or a tissue paper or cotton balls that you have wet with water. You can also use baby wipes. Just make sure that they are alcohol free to prevent irritating your baby's buttocks. When should parents be concerned about a lack of bowel movements in the newborn? So this is probably more of a question, is my baby constipated because baby is not pooping enough? Well, it depends on baby's age. For purely exclusively breastfed babies that are a little bit older, it is then normal that breastfed babies can go several days without the poop, every 3 or 4 days, or even every 5 days. As long as your breastfed baby, when he or she poops, it is still soft and seedy poop, then that is totally normal. But for breastfed babies, the normal pooping pattern is that they can go one stool a day or they can poop every other day. For formula fed babies that do not go for several days, then baby might be constipated. So at this point, you need to let your pediatrician know about it. How can parents manage diaper rash caused by frequent pooping? Well, to prevent diaper rash, you need to change baby's diaper immediately once your baby has pooped, and then wash with mild soap and water. And it is also advisable that once redness starts, you apply a barrier cream after each diaper change. And also, it is always a good idea to go diaper free for 1 to 2 hours per day. Is it normal for a newborn to pee during diaper changes? Yes, it is common for babies once you change their diaper and then they're exposed to air that they go pee. This is just a normal reflex and nothing that you should worry about. Take note though, these are general guidelines and it is always best to ask your pediatrician if you are concerned about your baby's pooping and peeing. If you like this episode, watch my next video where I teach you about other child health problems.